Hi guys, Tara Scott from Revitalize. We have been talking about gut health this month, and this is all kind of leading up to our gut class, which is going to be Wednesday, February 27th. But I just wanted to give you guys a little bit of information about the gut. So we talked about food allergies, elimination diet, leaky gut, but we haven't really given you any tools to help. So today I want to talk about what the protocol is to heal leaky gut. So anyone in the functional medicine world knows that there is something called the 4R program. Well, actually, they just changed it to the 5R program. So that stands for remove, replace, reinoculate, repair, and rebalance. So what does that all mean? The first one is remove. So obviously, if there's a food that is causing a problem, you want to eliminate that. We talked about elimination diet. If there's a bacteria or a pathogen, a parasite like I had last year, you want to remove that by treating that either with prescriptions or sometimes we use botanical treatments, which are non-prescription. So the first thing you got to do is you got to get out what's causing the inflammation. The second thing you need to do is replace. So along in the stool test also checks to see, do you have enough stomach acid? We talked about a world where we take a lot of H2 blockers and PPIs, so sometimes for people who have a low stomach acid, we need to have them give back their stomach acid, and we prescribe a betaine challenge where they take a supplement to help boost their stomach acid. Some people have a lot of luck with apple cider vinegar boosting their stomach acid, or even just drinking a little bit of lemon water first thing on an empty stomach. You can use lemon essential oils, or you can squeeze half a lemon into water. So that's the first thing you need to do, is you need to replace. The third thing you need to do is reinoculate. You want to be careful about that, because I think now people are going out and just getting high dose probiotics, and we talked about probiotics in a couple of videos. So we do the testing to see, what do you have in your gut? Do you need more or less? So that's reinoculate. That would be giving you back pre and probiotics. And the fourth R is repair. So we talked about leaky gut being like this, and then the gap junctions getting big and having, gaps between the cells. So one of the things that we use to repair is glutamine. Glutamine is an amino acid. I think I talked about that in one of the videos. We usually prescribe glutamine. Sometimes we prescribe colostrum. And these are things that once we know what the issue are, what the triggers are, we can prescribe that. And the fifth R that they just added is rebalance. So the problem is, and I kind of fell into this mistake as well, once we see a patient that has SIBO, a lot of times, or small intestinal bacterial overgrowth, we treat it, but then we don't think about the cause. So guess what? They get it again, and they get it back, and they have a continued problem with it. So Rebalance talks about the cause, which most of the time, guys, it's cortisol. So that means meditation, that means chewing your food, that means stress reduction, that means thinking about how you got in that predicament. So once again, 5 R's: remove, replace, reinoculate, repair, and rebalance. That is how you work with leaky gut. If you think you have any of these problems and you're interested, we're having a gut class on Wednesday, February 27th at 5:30 p.m. And that's going to be a group class, a way for you to get into our practice for a much lesser cost. So drop a comment below, call us, message us, and we'll get in touch and give you the details. Have a great day.